Welcome to In the Community with Tiffany K.
I am Steve Waters, in for Tiffany K this week, and thank you so much for joining us this morning. We got a lot of information to talk about, a lot of very helpful information, and I'm thrilled to welcome our guest this morning, Nana Noi, who is the COPE coordinator, and we'll explain that in a minute, for the Rappahannock EMS Council. Good morning, Nana. Welcome to the show.
Good morning, and thank you so much for inviting me. I'm honored to be here.
It's a joy having you. We were just talking off the air before we got into this about traveling the world, and now we bring it right back to Fredericksburg.
Yes, I'm a wanderlust, and so are you, so hey.
We are kindred spirits, for sure, Nana.
We are kindred spirits, yes.
Nana, first off, let's explain what COPE is. You're COPE coordinator. So COPE stands for?
Community Outreach Patient Engagement.
And this is with Rappahannock EMS Council.
It is. And with COPE, it's COPE Outreach, means we're out in the community, we're engaging, finding the needs of the community and what resources there are, and be able to match it for the public and the citizens of the community. So that's what we do on public health.
And we are going into a crazy week. This is a week full of events that have a lot of different ancillary little fingers going on here. So let's talk about what's coming up. And before we get to the schedule of events, this is a massive undertaking. You're kind of organizing all of this.
Correct.
So if you could give us, just for starters, an overview, sort of the spirit of the event, a 30,000-foot look down on what are we trying to do here?
So the theme for the event are You Are the Help Until Help Arrives. Meaning that we want anyone who lives, works, travels through Stafford, Spotsylvania, Fredericksburg, to know what to do when there is an emergency, really. So we want you to learn to stop the bleed, how to stop the bleed, hands only CPR. If somebody's low on sugar, a diabetic, you know what to do, stroke signs, practical things you need to do in an emergency. So that's why we are having a 5-day-long event to train, educate, and bring awareness.
And then it's interesting because when I hear you say those things, first off, it's great knowledge to have. It's common sense. We know we should have some skill set when it comes to CPR, basic first aid. But oftentimes we don't have that knowledge or skill set until it's needed. And you're kind of playing from behind in a situation like that.
Correct. We want to make it top of mind.
Right.
For everyone, because you never know when you will need it, you know. Especially now where we're in a multi-generational household, when you have, parents and you have grandparents, and you have children, so it's good for everyone and anyone to be able to know what to do, to save lives, because it takes minutes. For stroke, it takes minutes, right? Even for the professionals, first responders to arrive, it takes 6 to 7 minutes. So knowing what to do can save a life.
Let's talk about some of these things that are coming up, because we're in the weekend right now. But we have 4 events lined up through Thursday. So let's start with Monday, October 2nd.
So we're going to kick off with our Substance Abuse and Addiction Forum.
Okay.
And I would say that I don't know anyone who doesn't know somebody who is in recovery. We all know someone or heard of someone who's in recovery.
True.
It's all around us. So what we want to do is we are really targeting employers to be more sensitive and know what to do with their employees when they encounter such issues. We want it to be an inclusive environment when it comes to the workplace. So that's why we're hosting a forum and workshop, this event. So yes, we are excited about it, and we want, and it's not only employers, we want the public really to be more sensitive to know what to do and what resources are available in the community. And there's lots of resources that can be tapped into, because we find it's a slippery slope, substance abuse, and before you know, it's a suicide, right? So we want to catch that before that happens.
Substance abuse, addiction,
yes.
Mental health overall.
Yes.
It's not just the physical. It's not just the need for CPR or something like that. It can be the things you don't see.
Correct. And that's the dangerous, because it's not written on your forehead. Nobody knows you're going through what you're going through, right?
That's right.
Yeah. So
and again, oftentimes until it's too late.
And
then you aren't equipped to help out.
Correct, yeah. So knowing the signs, it's all about prevention, knowing what to do when you have someone in that situation, and not, as I keep saying, knowing what's available, because people just don't know the resources available to tap into. And we want people to be more equipped to do that.
And I think that's a great angle, actually going to the employers, promoting wellness and substance abuse prevention. Go to the employers, and then it trickles down
and
into the workplace.
And
reaches everybody.
Correct. So that's what we're trying to do. Yes.
So on October 3rd, National Night Out event, what is this?
So we're so excited. It's going to be at the Stafford Marketplace, and we are going to be a vendor there. We have a booth there, and we are all about public health education and awareness. So this is apparently going to have about 5,000 people at this event.
Oh, really?
How exciting is it? It's actually hosted by the police, and we are, as I said, we have a booth there, and we are going to be giving out information when it comes to strokes, heart attacks, cancer, what you should do, and stuff like that. So we are just vendors, but please come to our booth.
Please come by the booth.
By the booth, we've got goodies, we've got first aid, we'll teach you hands-only CPR and stuff like that. We have demonstrations. Yes, so come visit us.
All right. And on, let's see, the 4th, that's going to put us on Wednesday?
Yes, sir.
The mental health awareness and until help arrives.
Yeah, so this again, so as we mentioned at the top of this conversation, each day we're featuring You Are the Help Until Help Arrives. So we'll be giving demonstrations on how to learn basic first aid. So that's part of the October 4th. We're going to do mental health awareness, and I'm excited about that day, especially because we're going to have therapy dogs.
Oh, wow.
There,
yeah.
Yes. And my girlfriend is doing something on mindfulness, and we're going to have experts, mental health experts alongside to, again, talk about what to do when, you have that issue in the family and where to go, and all. I keep talking about what we have in the community in terms of resource. And again, we're going to have, we're going to teach mental health, hands-only CPR and basic first aid. But one of the things that I want to draw awareness about on that day is there was a survey done, and we found out that there's a lot of dog bites going on.
Really?
Yes, amongst children, because when children, vacation is coming up, and they go to grandparents' homes, and the grandparent has a dog, they think, we could just, go and, play with the dog, and then they get bitten. Or, so they don't know what to do. So we're going to have a session really educating kids about which dogs to approach, because they think all dogs are friendly,
right?
And what not to do. So that's a big thing for us as well. So there's mental health or therapy dogs. We want to know, what to do when you see a therapy dog and what not to do, and other dogs in general. Anyway, so that to me is an exciting day.
Oh yeah, again, to have a portion of that dedicated to that, it's one of those things that isn't top of mind. But to hear you say that, I'm like, well, yeah, I see a need for that 100%.
Yeah. So I mean, so we're and. It's a good time of day because you have kids, coming through.
Sure.
We're going to have Stafford Fire bringing their fire truck. So I'm going to wear a fire hat or two.
Hey, let's face it. Everybody loves a good fire truck, right? Those are impressive.
Right? Exactly. So it's going to be a family fun day. So come out, come support, get educated, know what's around you and how you can help save a life.
Wow, a lot of good information on all of these events. And then on, I guess, would be Thursday, A Taste of Wellness Week and Save Lives.
Yes. Okay. So we have approached a number of restaurants, and we have negotiated with them to put healthy menus on and give discounts.
Oh, and we got a ton of good restaurants in this town.
Exactly.
That's
Too
great.
Too many.
Yeah,
and they've
right.
all been so supportive. So, you go in there to talk about the fact that, you're supporting our week, Health and Community Week, and you may get a discount.
Wow.
So, yes.
There's a win-win.
That's a win-win, yes. So that's a win-win. So, yes, so we have our restaurants supporting us because healthy eating, having a healthy diet is so important to your well-being.
Well, it's a great lineup of events. Every day holds some amazing and valuable information. And if you can, maybe we can talk a bit about, because there's a lot of credibility here, some of the experts and speakers that are going to be participating in this event.
Yes. Okay. So the Substance Abuse Forum is going to be held at the Holiday Inn Express, Quantico. Mm-hmm. And we are going to have experts like Bob Barlow from the Mental Health America. We have Elaine McNeil from RACSB. We have Dr. Newstatter from Lloyd Moss Clinic. So we have all these experts, and we actually have some peers going to be there as well who've been through it, right, and come out the other end. And they'll be able to give us case studies. So it's going to be so exciting. We have Raymond Hennessy from Spotsy Regional Hospital. So we have great experts, and it's going to be a workshop as well as a forum. So the whole thinking is that, there's going to be interactivity, and you have to take something valuable away, unique to you and your organization.
Right.
So we really want, employers to come out and to this event. It's a free event. It is completely free.
We probably could have led with that. We kind of buried the lead on that. It's a free event.
All our events are actually free.
This is, that's a lot of great information, life-saving information.
It is, yeah.
And it's free.
It's free. We've got great sponsors. We have Mary Washington, Geico, Wegmans. We've got great sponsors. So, yes, our sponsors have done us proud. So come out there. These are all free events. We want you to be educated, know what to do, and learn about how to save lives.
And when we talk about mental health, and that obviously is a biggie, it seems that there's a stigma still attached. And I think this goes back generations.
Yes.
It goes back to when there was not a lot of knowledge about it. And so what we don't know, often we fear. And I think that that's where it sort of stems from. But to this day, you would think that there wouldn't be, with all the knowledge and progress that we've made. But the reality is, I think there still is a stigma attached to mental health issues. And it's very common and very prevalent in our society. I'm just curious, from your perspective, do you see where things could get better and some of that stigma removed so we can have open, honest, and productive conversations when people need to get help that sometimes are pushed back, I think, because of that stigma?
It's all about, I mentioned inclusivity. We all have to change our attitudes towards mental health, really, because when somebody is going through mental health, 9 times out of 10, they do not want you to know what's happening to them. So you should know the signs, but empathy creates a big part of it. Society should be empathetic. And understand when somebody is depressed, is having a bad day, knowing what to do to lift them up, and call 911. I mean, sometimes, or call 988. Do something. Say something. I find that people are afraid to seek help on behalf of others, because and that's why we feel, no, once you understand what it is and the why, and the fact that there's help, lots of help. If you can't do it, call a professional who can do it.
There's so many resources available.
So many tons and tons of resources available. So exploit it, use it. You can visit our website, copewellnessva.org, right? And we can help you. So it's important that you seek help and not just leave it alone.
Stay on the sidelines.
Stay on the sideline watching, right?
You're right. Because I think maybe not oftentimes, but I think there are those scenarios where the signs are there and we don't always read the signs.
We don't read the signs.
Or we do and we think, well, that person's just having a bad day. I had a bad day yesterday. They'll be fine. And that's where that two-pronged thing is. One is education, which we're talking a lot about these events over this coming week that help with the education. But then there's also the take action component, which is, well, what action do I take? Well, you look up these resources, there are things I can do to help somebody.
Correct.
And I think that's huge.
It is. A phone call, 911, 988. There's so many,
Do something.
Do something. Do something,
If you see someone in need.
See someone, yes. This is see something, say something. Right? Do something.
I do want to restate the website again. It's copewellnessva.org. Now, on that website, will they find the list of the events that are coming up?
Yes, they would find the list of events that are coming up. Yes.
Which is great, of course. But question, Nana, what about the other long-term goals maybe that you have in mind, promoting community health and wellness beyond this coming week? This is an ongoing thing.
It is, yes. As I mentioned at the top of the conversation, we are all about public health. So our long-term goal is for everyone who lives, works, plays here, to have a healthy lifestyle, to know what to do with their neighbors in terms of neighborliness, to be able to know what resources there are. So our long-term goal really is to save lives. Right. You are the help until help arrives. So please, please, please have a first aid kit in your car, in your house, available to you. Have an aspirin in your purse. Please, please, I have a first aid kit in my bag.
Do you really?
I do.
Oh, and do you carry that everywhere?
I carry that everywhere.
It's those things we don't
I carry
think
that
about.
everywhere. Yes, I do, and I'll leave one with you.
I appreciate that. You know, it is crazy because we all have things we'll never leave the house without. Our cell phone
Our
being
cell
one,
phones.
right?
Yes, exactly.
But you never automatically think. And by the way, I know this is a radio, so our audience can't see, but the first aid kit you're holding up is a very small.
It's a very small kit. Yes, it is.
You're not cluttering up your purse or,
No.
or your glove compartment in your car.
No.
Keeping that nearby.
Exactly. Because emergencies happen at any time. You know, you're at home, you know, there's a fire, you're out there, you're with your kid, they fall into the ground, there's a bruise, or
Right.
somebody, an elderly, you know, toppled over. You have all this, there's gauze, there's everything in here, you know, and there's a first aid guide as well, which tells you good first aid tips, you know, on what to do. And it's also Spanish, because one of the things we do also at COPE, which I haven't mentioned, is the fact that we try as much as we can to have translations of our leaflets in different languages. So we have it in Spanish, and so this one has got this English and Spanish at the back. We try, because we now live in a multicultural society, right?
Oh,
you know,
100%.
Exactly. So we try, and Google Translate is my friend as well. You know, so I travel. When you travel, you need Google Translate, don't you? So hey.
Right. It is a pretty great thing to have for sure.
Yes, exactly. Yeah. So we will be giving out first aid kits as well. So
Okay.
Yeah.
We're talking with Nana Noi, who is the COPE coordinator for Rappahannock EMS Council. And as we see the list of events coming up, I was going to ask, do you need volunteers? Do you need people to participate in workshops? I know most of this is probably already nailed down for the run. But going forward, if somebody's listening this morning saying, oh, well, this all sounds great, I'd love to be a part of that. And I don't want to throw this out of left field and catch you by surprise. But is there a way for people to get involved in these kind of activities?
There is. Again, on the COPE Wellness VA website, we've got a page, and we have COPE community champions and COPE community ambassadors. And what the ambassadors do, really, the role is to be trained, you know, have on basic first aid, and carry on and teach others. Right, and the champions do that, you know, at work, anywhere. They engage and try and get people, you know, together for first aid training. There's a cost if you want to be professionally trained, right? But just knowing basic first aid skills like we're doing, and so the CPR, you know, going out there, joining us when you have initiatives, and being a COPE champion means you're saving lives. So there's a form there that you can register and enroll. So I encourage people to do that and just come and join us, because we're always doing something in the community. Always. We always need volunteers.
So at whatever level someone might be going.
Whatever level. Be a COPE champion, be a COPE ambassador.
Right.
Please. Yeah.
Right. But all of it is such valuable information. Again,
It is.
I like the phrase a lot. You are the help until
The
help arrives.
You really are.
When there's nobody else around, and whether
Exactly.
somebody's injured or you could be at a restaurant, somebody could be
yes,
choking on something.
Exactly.
Do you know what to do? We've all seen it done, but have you actually learned how to do the Heimlich
Exactly.
maneuver?
Yeah.
Or if somebody is injured, do you know what to do? The basic
Exactly.
steps until paramedics, EMS arrives.
Exactly. And unfortunately, I mean, sometimes we have mass shootings. I mean, things happen.
Oh my gosh, yes. You're right. You never know when we leave our house, whatever time that is, morning, afternoon, evening, you never know what's going to happen between then and the time you get back home.
Exactly, yeah. So that's why we're encouraging people to have their first aid kits, you know what to do, and just help save lives. We want to reduce the mortality rate, you know, and I know we all have a part to play.
Mm-hmm.
You know.
And it all really does start with education.
With education, yes.
And again, the website, copewellnessva.org. It goes through Thursday, and there are events every single day.
Right.
And you can find the list of events and what is going on those
Correct.
days
Yes.
on that website.
Yes. Thank you so much. But thank you for inviting us, for giving us the opportunity for the community to know, you know, our passion for this, and just join our vision, really, for us to help save lives. So thank you so much.
Well, it's a pleasure, Nana. It's a pleasure to meet you and have you in today. And I look forward to all the knowledge, all the skills that will be delivered to everybody who takes part in this week. Certainly a noble cause, and I know it's a lot of work, but the next 4 days are jam-packed with great information and help. Let's run down just the itinerary one more time for the week. Starting tomorrow, the Substance Abuse and Addiction Forum and Health Fair and Save Lives campaign. That is tomorrow from 9 a.m. till 2 p.m. at the Holiday Inn Express. Then on Tuesday, the National Night Out event. This takes place Stafford Marketplace from 5 p.m. till 8 p.m. On Wednesday, Mental Health Awareness and Until Help Arrives event. That is at the Jeff Rouse Swim Center from 2 o'clock until 8 o'clock. And Thursday, a Taste of Wellness Week and Save Lives at Stafford Restaurants supporting wellness campaign. Now, that's at different restaurants, again, as we had covered, that are serving up specially priced healthy foods and providing healthy living tips. So there's a lot going on this week, a lot of information. Again, the website, copewellnessva.org. And Nana, thank you so much, not just for coming in this morning, but also for all the work you're doing putting this together this week.
No, thank you. And you played a big part in that, so thank you so much.
Well,
You've
thanks.
been gracious. Thank you.
Thanks, Nana. We'll see you next time. And there will be a next time, by the way, because
thank you.
as we said, this is ongoing. This isn't just this week of events and it's
Correct.
done. There's plenty more work to be done.
Thank you, Steve.
Thanks for your time. And if you need more information, again, that all-important website, copewellnessva.org. Nana Noi, the COPE co-coordinator for Rappahannock EMS Council, our special guest this morning. And if you would like to explore being on In the Community, maybe you have a charity or a nonprofit that needs attention, a cause that needs attention brought to, and information to get out to the community, we'd love to hear about it. You can reach out to In the Community right now through this station's website. And we'll see you next week.